my mom's urologist said, this just might not be worth it anymore. It might be doing more harm than good. And it's okay to stop. And it's okay to stop seeing me. And I really appreciated him saying that to me because I did tell him while I was sitting there waiting for him to come in the room, there was a part of me that was just saying, is this even worth it anymore? And he answered my thoughts. He completely knew what I was thinking and he answered it before I could even say it. So maybe that's what you need to do. Really, if you're not sure, have a real deep discussion with your providers and tell them what's going on. Tell them how you feel. Tell them what happens with your loved one when you have to get ready or when they're in these appointments. And ask them, is this doing more harm than good?
Hi everyone, I'm Lexie Callies. Do you feel the squeeze of caring for an elderly loved one and school-aged children? Then welcome to the Sandwich Stories. Let's dig in.
Hi everybody. It's Lexie Callies with Sandwich Stories. I hope you're having a really great day. I had to really get myself going this morning. My son had to be at school very early, so I had a 6 o'clock wake up call and I was not happy. Anyway, so that's where our song of the week will come into play at the end of this episode. So anyway, I just wanted to say hi and to let you all know that it is okay to stop making appointments and seeing certain doctors. And I'm saying this because recently um I've had to do this. So first, about a week ago, my mother went to the urologist. She used to get a procedure. Um, and for those who don't know that this is available, maybe just this tidbit can help you. That she had frequency and urgency. And one of the treatments you can have that is covered by Medicare is bladder injections with Botox. So you're going to inject your bladder with Botox. And the urologist is the one who will do it. And it will help with the spasms so you don't have the frequency and urgency. And my mom's been doing this for, I think this was year 3 or 4. So we've been doing it a while and it helped. But now she has had 3 UTIs in a very short amount of time. And we talked to him, and one of these UTIs was found when we were there because he has to check her urine just in case she has a UTI, and this could make it worse. And so we got her in there. Unfortunately, we got her all set up, got her all ready to go. They did the sample, and it came back with a UTI. And so then the doctor came in and spoke to me and my mom, and she said she didn't have any um, symptoms of a UTI, but it was there. So we sent it for a culture so we knew which antibiotic would work best with this. And I did tell him that this is the third one in about 2 months. So he was asking me questions like, do you think this is working anymore? If it is helping her not have frequency and urgency, it could be causing her to retain too much urine. And then this is actually causing more problems than good. Because she needs help to use the restroom, she has to either tell people she has to go or they just have to put her on a schedule and have her go. And maybe she can't um, empty her bladder out completely because of the Botox. And so we decided there, the doctor was sweet, very nice. He's one of the best doctors we've had. He's actually head of education within the urology department. He's a really great guy. And so we said, you know what, we're going to go home and I'm going to think about it. And I really thought about it. And I think he's right. This just isn't working anymore. So we just won't do these appointments anymore. And that's okay. So just yesterday, my mom's ophthalmologist gave us a call because I had to cancel an appointment with her back at the beginning of the year. And she was on the list. And I completely forgot to make the appointment again. And so the nurse calls me and says, hey, we need to schedule an appointment with Peggy. She needs to get a glaucoma check. have her eyesight checked. And I told her, I said, you know, I don't think we're going to do it anymore. It's just too much stress and too much work for my mom. It's exhausting. She doesn't understand what's going on. She doesn't always keep her eyes open during the exam. She doesn't know what to do. It's just so hard and frustrating. And I know that she wants to help and do the best she can, but it's just not possible anymore. And so I told the nurse, I said, I understand needing to check her for glaucoma, but that means dilation, eye check, all the things. And I just don't know if my mom can do it anymore. I said her capacity has diminished since last year, and it's just really hard and stressful. And she understood. The nurse understood. She said she'd make a note. She looked back and read the notes from last year about how the appointment went. And she agreed. She didn't think that this would probably be a good idea right now. And I said, I could come in there with her, no problem. But she could be one of two things: have a really great appointment, be in a great mood, be able to follow directions, be able to do everything we need her to do, or she can't do anything. Or she shuts her eyes and then doesn't open them for an hour, which has happened. And so I've just started thinking is like, it's okay to start saying certain doctor's appointments just aren't necessary anymore. What is necessary? You have to start thinking which appointments are the most important, which ones can you not miss, and prioritize all your doctors and say, do we need to go to the ophthalmologist anymore? Do we need to do this procedure anymore with the urologist? Do we need to see the dentist anymore? Now, my mom can still do the dentist. That one is a little hard and it's a little confusing for her, but because she can just lay there and they put a little bite block in the back of her teeth to keep her mouth open, that is helpful. And I do believe in getting your teeth cleaned. And so that one, we went from doing it 4 times a year. Now we're only going back to 2 times a year because 4 times a year was just too much for her and too hard for her. And so that's when I say it's okay to say no more. It's okay to say this doctor is the most important doctor we see. We have to see this doctor, whatever it may be. These other things, they're just not necessary anymore. It's kind of like my mom a couple years back. The PCP was like, she needs a colonoscopy. It's been over 10 years. And I said, okay. And she was already in assisted living. And I said, yeah, I don't think we could do that. I don't think we could do the prep and get a good prep. I mean, she wouldn't be able to get to the bathroom. It would just be so hard and such a mess. And the likelihood of her becoming dehydrated or not doing it well enough that even if she did get to go into the doctor's office and do a colonoscopy, would they be able to see anything? Did she clean herself out well enough? And so then he said, well, we could do the Cologuard. And so I said, okay, because I really didn't know much about it. And so I said, that's fine. So he sent in an order for it. It got mailed to my house. And then I read all the instructions. Yet again, she would have needed help. It would have had to be collected a certain way. And I just don't know if that was going to be possible. And I wasn't going to have a nurse or a caretaker sit with her 24 hours a day, um, hoping that she had to go to the bathroom so that we could get this sample. And then I spoke to a friend who is a gastroenterologist. I said, can you please give me some guidance on this? The PCP is really pushing me to get this colonoscopy or do Cologuard. And so I told her what was going on. I said, this is what's going on with my mom. I'm afraid of X, Y, and Z. And is it even worth it? Is it worth putting her through anesthesia? That's the other thing. With Midodrine, When an anesthesiologist sees midodrine on the patient's chart, that is one medication that they get worried about because you have to not be on that medication, which means the blood pressure is low. And then anesthesia makes your blood pressure lower. So then they're not thrilled when they see midodrine on the list of medications. So I told her all of this was going on. And she just said, she was 73 at the time. And she said, she's 73. It's not worth it. She said, by the time she's 75, we would say no more um, colonoscopies anyway. So she said, it's really, so you're just stopping 2 years in advance. And so I went back and the PCP said, well, where's her colonoscopy? Where's her Cologuard? Did she get it done? And I said, no, we didn't get it done. We're not doing it. It's just too hard and not worth it to go through everything. And then I did explain to him that I did not just come up with this on my own, that I did meet with a gastroenterologist and got their professional opinion about what was going on with my mom and what they thought. And so he said, okay. And he let it go. I don't think he was thrilled about it, but he let it go. And so, like I said, there's just things you have to start going through. What is important? What is worth the stress? What is not worth the stress? Is it going to be beneficial anymore? And if the answer is no, then cut it out. It's one less thing you have to get them ready for. It's one less thing that you don't have to deal with the stress of it all, and that your loved one don't have to deal with the stress of it all, because it is stressful. It's, the preparation for it, or do you not have to take medication? All these rules that come with it, it's just not worth it. And then you're not wasting your money, your time, the doctor's time, and your loved one is not feeling like they've failed, or they're not doing a good enough job, or they just can't participate. So look through your doctor's list, look through procedures, and start to triage. Start to say, this could go by the wayside. This is at the bottom of the list. If we can go through Doctor 1, 2, and 3, which are must do's, and then Doctor 4, 5, 6 are kind of, then maybe you say 4, 5, 6 are no longer needed. And it's okay. And if you have a really good doctor, they will understand, especially if you've been with them for a long time. They know what's going on with your loved one. Even if they see them once a year, they could tell when, if they're really knowledgeable of their patients, then they will know what is going on and is it even worth it. And just like my mom's urologist said, this just might not be worth it anymore. It might be doing more harm than good. And it's okay to stop. And it's okay to stop seeing me. If your facility can do UAs, if they feel that there's your UTI, then have them do it. You don't need to see me unless something major comes up. And I really appreciated him saying that to me, because I did tell him while I was sitting there waiting for him to come in the room, there was a part of me that was just saying, is this even worth it anymore? And he answered my thoughts. He completely knew what I was thinking, and he answered it before I could even say it. So maybe that's what you need to do. Really, if you're not sure, have a real deep discussion with your providers and tell them what's going on. Tell them how you feel. Tell them what happens with your loved one when you have to get ready or when they're in these appointments. And ask them, is this doing more harm than good? And if it is, can we stop coming? So think about that. I know we've all been there. And so I hope that kind of gives you the permission to say no to a doctor and just to say we're not doing it anymore and feel okay with it. All right. Okay. And the song of the week is I Love Me by Demi Lovato. And this is really the song you need to listen to say, you know what, call yourself out when you are not loving yourself. You know what? Because it's okay when you feel bad, but know that you need to still love yourself. And like they say, if you can't love yourself, how are you going to love somebody else, right? You put out what you give yourself. So when you give yourself love, you can give other people love. All right. I hope you have a really great week, and I'll talk to y'all soon. Okay. Bye.
Thank you so much for listening to Sandwich Stories. I really hope you learned some new things and enjoyed it. If you did, tell a friend, tell your mom, tell your sister, tell your dad, tell everybody you know to also listen. Maybe they'll learn some new things, how to help each other out, and find us at Sandwich Stories Podcast. Thanks so much.